Okay, it's an honor to welcome you in this session. My name is Ruth Erdelyi, and I have good news for you. We will gently put aside methodology and the heavy tech topics and just speak life in this session. Leading up to that, I would like to begin share a moment in my life that defined my volunteering activity as a person. Working for a Ministry of Interior, running a team of 250 people, a budget of 2 billion euros. I was driving to my dreary office day in my car and singing along to a song from a local radio. All fine, but in a moment that song was interrupted with a police announcement. The announcement was that there is an active shooting in a residential area of my town. And they were asking citizens to leave the area as soon as possible until further information is gathered by the response services. I vaguely remembered I took my ID of the voluntary member of the National Crisis Intervention Team and decided maybe I'm needed there more than in the office. So I turned my car. I was actually 5 minutes drive away from the scene of intervention. I put on my blue vest. I took my little ID, showed it to the officer leading the intervention and asked, how can I help? He just silently pointed me to a scene. There was a lady screaming and fighting with two officers behind a red line that separated walkers and people passing by from the scenes of active shooting. And that was the moment when my deployment began. I walked up to her and our eyes met, and she was still screaming, but the only question she actually managed to put together was, what do I do? She was actually the mother of the children and the first man shot by the shooter that morning. And she was trying to force her way back into the zone of active shooting to recover her family and learn what she can do for them. She became the first client of my risk reception information and support center that day. But what was the moment where that defined that day for me was the moment when our eyes first met. And answering to that question of hers is, I do not know, but I'm going to be here with you until you can answer that question for yourself. And just that moment of connection, of acknowledgement, and of embrace in humanity helped her to actually step away from that situation. And she followed me to a safe spot where we started to establish a reception center for all the others involved. That day unfolded, there was many victims, they actually were able to stop the shooter, and we just went on doing our work. For many years later, when I was confronted with inner insecurity about myself, I used to revisit that moment of deep, true connection with her in the moment of the crisis. And that moment became my personal power bank, because it was the moment in my life when I felt rooted, when I felt present, and when I felt like I'm there for a purpose. And it serves as a source of self-assurance to me for many years after. And it also gives me a very personal answer to why is it good and to volunteer. And what I tell myself is that stepping towards life, you actually come closer to embracing it by taking that opportunity to just be available, be present, be yourself, and support others when they're in need of support to a crisis. So that is me volunteering. And now I'd like to ask Tobias to share a little bit more with us about official management of volunteers in daily emergencies.
Thank you. Thank you, Ruth. Or perhaps not thank you. I will never be able to compete with any personal stories as compelling as yours. I don't really have anything to come with that. I mean, what kind of... I forgot my razor at home. And I thought about buying a new one, but with 50 minutes talk, the cost per minute of face exposure is kind of too high to merit the purchasing of a new one, so you'll have to excuse my stubble. Anyway, now that I have wasted some of my precious 15 minutes on telling you that, I'm going to talk about volunteers and volunteering in emergency response and in Sweden in particular. So in Sweden we have a number of different types of volunteers. Here I've tried to divide them into three, very roughly, three different groups called organized volunteers, semi-organized volunteers, and informal volunteers, where the organized volunteers are kind of the what you could call traditional ones, the ones that have been around for quite some time, that are highly integrated with the formal emergency response system, like the Sea Rescue Society, for example. They've been around for 100 years, and they do a very important part of the sea rescue in Sweden. But in Sweden, we don't really have the kind of organized volunteers for daily fire services or daily medical emergencies and so on, like there is in many other countries where they kind of rely on volunteers to do part of their job, and therefore they are highly integrated and they do work more or less as professional resources. We don't really have that in Sweden, and moreover, we see more and more difficulties in getting people to join these traditional volunteer organizations. People, at least in Sweden, they don't really want to sign up for anything long term, go to meetings every month and trainings and all that stuff. They are really more, they would like to help out, but on their own terms. Basically, give me information, ask me, can you help? And perhaps I will come if it suits my plans, if I'm available, and so on. And we have a number of different initiatives that we put here under semi-organized volunteers, like Missing People Sweden. You sign up and you get information if somebody has gone missing, and if you're able, you will go and help out with the search. So no long-term engagement necessarily in the organization, although they do have a core staff of people actually doing a lot of work as well. But and I'm going to tell you more about two other initiatives like the HeartRunners and the Citizen First Responders as well. Then we have the third group, which are the informal, the spontaneous volunteers, the ones who are bystanders, the ones who hear on the radio that there has been an incident and they go to help and so on, which are then even less integrated already in the formal emergency response system. But for this presentation, we'll focus on the semi-organized volunteers. So this is one of those academic slides. So I'm a university professor, so I have to show that I'm not the only one who has been looking into this area research-wise. There's a lot of people who have been looking into it. But I will only say about this slide that from a resource management perspective, semi-organized volunteers and spontaneous volunteers, they are kind of difficult because you don't really know if they are available. You don't really know exactly what they can do or how well they can do it. So you have a lot of uncertainty in regards to the availability of this resource and the capability of this resource, which makes it very difficult to plan for this resource. You don't know if you will have them when something actually happens. When something has happened, you can ask around and see, can I get some resources here? And then you can get more information. But before anything happens, you basically have very, very uncertain information about it, which makes for a great challenge. But in regards to the initiatives that are gaining more and more ground in Sweden, we have something that I here call Citizen First Responders. This is an initiative from fire services in Sweden, who recognize that in some, especially in some of the rural areas under the area of responsibility, the expected response time for fire services is long. So this started, the first initiative that is still up and running, it started in Sundsvall in Sweden, which is not far from where I grew up. And they know that we have a lot of villages which have more than, it will take more than 20 minutes for fire services to get there, even more for the ambulance. So what they thought that, okay, so we'll check the interest, see if are people interested in getting information if something happens, and go out and try to help. So they gathered information from these villages, and they got lots of responses. People were very interested. They got signed up for SMS lists. They got some basic training in mostly what not to do. Kind of, if there's a traffic accident, don't stand, park in the middle of the road, don't stand close to highly trafficked roads. If there's a building fire, don't go into the building, stuff like that. But they also got could get some other basic training and so on. And then if something happens in their village, they just send a mass SMS to everybody who signed up, and they got the information, okay, so we perhaps have a cardiac arrest in the village, and they can go there and try to help, try to start CPR. They can take their handheld fire extinguishers and go and try to put out the fire and stuff like that. So the idea is that they are supposed to be able to do what anyone could have done if you just walked by and saw that something is happening here, and perhaps we can help. This has spread in Sweden, so now we have 4 or 5 actively working initiatives, both in rural areas, but we also have a tryout in suburban areas in Stockholm, where they also have the idea that by engaging the population, you could get some sort of prevention measures, reducing the number of car fires and stuff like that. So there's a lot of interest. So it's actually, the interest is so big that it's kind of a challenge for the fire services, because they don't get any separate budget for trying to handle this, and they need to have people from the fire service engaged in this. So that's one challenge. Another challenge that the volunteers raise is that they don't really have any specific equipment. They would like to have some basic equipment to be able to do a better job. But then there's a kind of a trade-off from training them and equipping them with lots of stuff. So we don't really know where the border is between you're doing this as a volunteer on your own time. We don't have any responsibility for whatever happens to that. Now we have trained you and equipped you, and we send you to something, and we will need to take employer responsibility for whatever happens as well. And finally, we also have the alerting or communication solution, which is quite a challenge. The SMS lists, they work okay, but if you're out abroad on a conference, for example, and you get an SMS saying that, okay, so there's a car accident in your village, I can't really do anything. If I'm visiting some friend in another village, which is also connected, I will not get an SMS, even if I could help. So there's a need for some smarter solution, some sort of smartphone app solution or something that can take positioning into account and all that stuff. And the Swedish PSAP, SOS Alarm, is developing one of these and are testing it right now. So hopefully we'll have something that will be available and working for these initiatives in a short time. Some of the success factors is that you need to have some sort of champion, someone who really cares about this, both from the fire services and from the volunteers who kind of help out organizing it. There needs to be clearness in responsibility and roles. What are they supposed to do, and how are they supposed to act when the fire services are arriving at the scene? I have some pictures here this is from a training event. We tried to set up actually an academic experiment where we wanted to send out these volunteers to a staged traffic accident. And it was a bit funny because we had to tell them beforehand that there will be an alarm tonight, and if you want to, you can go. And so we expected a lot of people to show up because these guys they thought this was nice and fun and so on. So we also thought that, okay, so there will be some sort of chaos on the scene with lots of cars coming in, and they will probably park in the wrong places, and that will be really interesting to observe. But it turned out that they all gathered beforehand in the community hall, and then they co-joined in the car. So there were like 3 cars turning up with 5 people in each car. So that was kind of, we didn't get a lot of observation for that. But from the training exercise, it was really nice to see what they were able to do and how they cooperated and all that stuff. So that was a nice exercise from that point of view. So the second initiative I wanted to talk about is the HeartRunner initiative, or SMS Lifesavers, which was started as a research project over 10 years ago by Karolinska Institutet, with a basic idea that if we can get information to people who might start CPR or might start defibrillation, can we reduce the first response times to these kind of patients? So it's out of hospital cardiac arrest patients, and it has been a nice success. It has been running for a long time now. It's kind of operationalized and run by the HeartRunner company. If you want to know more about them, they are in the hall. You can raise your hands. Yes, so ask them if you want details about this. Now I just learned that it's more than 96,000, not 76,000, registered volunteers in Sweden, over 100,000 in Denmark, I think, who get, basically you download an app and you register and you say that I'm available if there's a cardiac arrest close to me. So then this is an old screenshot, so it probably doesn't look exactly like this. But you will get task from the system saying that you should go pick up a defibrillator and then you should go to the patient, or you should go directly to the patient. So it's a very simple idea which works very well, and there's been a lot of publications on how they can reduce the first response times and all that stuff that you can read. What we do from my university is that we look at how can we do the resource management more effective. So we develop models and methods for optimized task allocation. Just as an example here, if we have a cardiac arrest patient, we have a couple of defibrillators, and we have some volunteers. How it works now, it's like static decision rules, which says that, okay, so you should pick up an AED and you should go directly to the patient and so on, without much thought into exactly who to assign to what. So what you can do is, if you send out alerts to these guys and then they say, yes, I can go, then you can assign a task, say that the first one is the first one to say yes. Then you can say that, okay, so you should pick up a defibrillator and go. What's a bit difficult with volunteers is that you don't really know what they will do. So even if they say, yes, I will go, and you say, pick up a defibrillator, they might go directly to the patient. Or they might understand, okay, so I said that I could go, but it will take too long time, so I will just abort this. So if you want to do this in a smart way, you have to take into account the uncertainties with what will actually happen. So we have a lot of probability stuff in there, trying to calculate the probable response time from each of the volunteers and what they will do and so on, which is really nice from a mathematical point of view, which I think is fun to work with. Another possible strategy, this is used in the Netherlands. I know they look at all the volunteers that are around the incident, and then they decide before dispatching anybody who should do what. So they say that, okay, so if there's a couple of defibrillators, and for this guy it's not too far to pick up a defibrillator, so we'll send this guy to the defibrillator, and this one will have to go directly, and the 3 closest one will have to go directly. So this can also be formulated as an optimization model, which is the absolutely best way to do this task allocation before dispatching these guys. And then half of them will probably not even notice the alarm, for example, so you have to take that into account as well. And this variant to assign before dispatching, of course, is necessary if you have like SMS dispatching, because you have no idea what they will actually do after you send out the dispatch. Otherwise, it's probably better to send an alert and wait a while and see who are available. All right, there are some new initiatives for this kind of thing. We have the drones. We had EverDrone here yesterday talking about how they deliver the AEDs, and we have Volvo who have installed cars with AEDs, and these are very, very nice initiatives to get the defibrillators even quicker to the patient. And these, from a resource management perspective, these have to be integrated with the runners as well, the volunteers on foot or bike and so on, which is a very nice problem as well to look into. All right, that was my last slide. If you want to, you can check in our research center, the Center for Advanced Research in Emergency Response. You have the link here and you get the slides after October sometime. Okay, thank you very much.
Thank you very much, Tobias. One of the reasons why I love working with volunteers is they say what they think, because they feel free to do so. We have a legendary fire chief at my volunteering unit whose favorite quote is, well, you will meet many people able to tickle your body during life, but very few who can tickle your brain. So the question for the audience for the moment is, do you have a brain tickling question for Tobias? I see no hand raised. So Tobias, you were probably more informative than you intended to be at the beginning of this session. So thank you very much for that. And now I'd like to give the work to Adam Williams, who will be sharing with us the experience of St. John's. Thank you very much.
Great. Hi, I'm Adam Williams. I'm the National Head of Community Response at St. John Ambulance. I've got the best job in the world because my job enables and supports volunteers to save people's lives. And there is no better job in the world than saving somebody's life. St. John Ambulance is a charity. We're a non-government organisation. The brand St. John is operational all across the world, or EENA across Europe. And St. John Ambulance in England provides first aid, ambulance and medical provision to a whole range of services, including public services across England. And across the UK, there are 10 ambulance services, 10 public government ambulance services, and St. John Ambulance provides backup and support to all of the ambulance services in times of need. I'm going to talk specifically around our last 18 months, which has been exhausting. I went on holiday last week and had all sorts of exciting things planned, my first getaway, and all I did was sleep on the beach for a week because I was just exhausted. But St. John Ambulance, now more than ever, has really stepped up to the plate. And we've had to really turn the whole charity upside down to continue doing what we're doing. And ultimately, as I say, I make no apology for saying this, we are saving people's lives. Volunteers, day in, day out, are saving lives. Right at the beginning of the pandemic, as it was emerging in January to March, we were coming out of quite a difficult winter. The National Health Service in England, the NHS, was under immense pressure, and we were already supporting the health services. We provide volunteers on weekends, we call them booze buses, to get drunk people home safely. We were providing first aiders in emergency departments. We had volunteers crewing ambulances 24/7 on top of our day-to-day work. So we were already coming out of a really difficult winter, and over 14,000 hours of volunteering support was given to the National Health Service. And on top of that, we were inspected. To operate ambulances in England, you have to be registered with the Care Quality Commission, a government authority that will come and inspect you to make sure that you're operating safely. And we got a good rating, which is an excellent achievement. On top of that, we trained 60,000 people plus in first aid, which is one of our core activities as a charity. And then suddenly, overnight, St. John Ambulance came to a halt. All of our training stopped. all of our public events stopped, concerts came to an end, football matches stopped, and we had to very quickly decide what we were going to do. The National Health Service needed our support now more than ever, and we launched our biggest response since the Second World War. Very quickly, we put in crisis response modes, and we set up tactical and strategic command centres across the country to coordinate this emergency response. We very, very quickly trained 375 trainers to understand COVID more. We recruited doctors, nurses, paramedics to help us train volunteers, and we agreed what our relationship was going to be. We couldn't send our volunteers to provide first aid at football matches because there were none, so we sent them to A&E departments, to hospitals. We sent them into emergency departments to look after patients who were overwhelmed. We sent our volunteers into intensive care units to prone patients who were ventilated. So from one day, a volunteer was standing at the side of a football match looking after a sprained ankle. The next minute, they're holding the hand of somebody that is dying because of COVID. That is what volunteers were doing. They were literally holding people's hands when their families could not see them. Then the first wave started. We continued to provide a huge ambulance response. Ambulances were queuing up outside hospitals because there weren't enough beds. The military set up huge hospitals, 4,000 bedded hospitals. And again, there were no extra staff to send into these hospitals. So St John Ambulance sent our volunteers to care for patients in these hospitals. We also had to make some very, very difficult choices. We're a large charity, £100 million turnover. However, we still had to make some difficult decision in making staff redundant. We had to sell some of our property. All of our training income come to an end. And by the end of June, 250,000 hours of support was given to the National Health Service, far more than we'd ever done even in winter. And over 4,000 of our volunteers were now in hospitals, were supporting our ambulance services and providing PPE and logistics support across the country. We were helping the blood service, making sure that they could obtain blood safely as well. And then in July to September, over the summer, the government were trialling the return to mass events, and we were instrumental in helping some of those events take place, and also helping the NHS catch up. We were taking patients to hospital. We were delivering COVID swabs to patients' homes so they could return back to elective surgery. None of this would have happened without the power of volunteers. People would have died if it wasn't for our volunteers. And then in the kind of October to December, we realised that actually there was another growing second wave of COVID. There was another increase in demand. And then on top of that, there was another difficult winter. And then the hope of a vaccine became available. And I remember with me and my boss, Craig, who sadly couldn't be here today, we dreamt up the idea of stepping up to support the vaccine programme. And we had a very ambitious programme of recruiting 30,000 brand new volunteers in 3 months, something that we've never ever done before. Alongside this, we knew that we needed to reinvest money into new ambulances, and we trained 400 vaccinators to the new year to provide support to the National Health Service. Vaccinating patients is quite a simple skill. You've just got to be good at darts. But we knew that the health service did not have lots of extra staff just to release when they already were under a huge backlog. So our volunteers started vaccinating in hundreds of vaccine centres. We recruited 30,000 volunteers. We deployed them across England. And right now we are entering the booster campaign. And very recently, we marked 1 million hours of volunteering support to the health service in a whole range of different services, including ambulance provision, including vaccinations, and obviously now, thankfully, the return to events and training courses, including mental health. And the scars that it's left some of our people is immense. The well-being that we're now having to put in place is really important. Our volunteers have been through some very traumatic times. As I mentioned, you have a volunteer at the side of a pop concert looking after drunk teenagers, and the next day they're in an intensive care unit looking after critically ill patients. That's the power of volunteers, and we're immensely proud of what they do. How did we do this? We had belief in ourselves. We knew that we could do this. Our last biggest mobilisation was the World War. We had to step up and fight this war, and at times, even now, it is still feeling like a bit of a war. We reorganised the organisation. We set up central command centres. I was part of the strategic command team to really lead the organisation through the pandemic, focus volunteers on what they needed to do, and believe in them. We had to allow volunteers to know that they, to your earlier presentation, we have highly trained professional volunteers. If somebody calls 999 or 112 for an ambulance, 2 volunteers in a blue light emergency ambulance could turn up and save that person's life. That's the power of volunteering. We had to believe in our volunteers and put on real fantastic training to enable them to have the skills to step forward. We were still learning about COVID at the very early days, when to wear a mask, when not to, how to don and doff PPE safely. There was a lot of change in government advice, which was really confusing to us as well as volunteers. We had to collaborate with sector partners, and as I mentioned, we had some difficult financial challenges along the way.
St John is helping to vaccinate the nation. We've got volunteers here from all walks of life who are playing their part, helping to vaccinate citizens and taking a step forward to fighting COVID.
St John Ambulance are volunteers who are helping in the vaccination programme. So they have been trained to support us with immunisation of the public that are coming through this facility.
I've got grandchildren that I'd like to be able to see more and do more things with.
We are playing our part in helping to vaccinate, but also to look after citizens when they've had their vaccination, to make sure they feel reassured, they feel comfortable, and to know that they've taken that first step towards fighting this terrible disease.
Well, I think they bring a lot of energy to the programme. I think they're incredibly reliable, so they're always keen to get involved. They've really been fantastic.
I've been part of the vaccination team here at the ExCeL, and today I've been vaccinating members of the public who have come in. I think St John is playing a really big role in this whole operation because the support the NHS staff are receiving from our volunteers is immense, and everyone I've spoken to from NHS seem to feel the same way. Because we are trained to be able to administer vaccines, it means that the NHS services aren't as stretched.
I think they do a wonderful job to supplement the NHS, and they're doing it all voluntarily. So great people. There's a lot of false information about the vaccine, and hopefully more and more people will believe that it's fine. And yeah, it's painless. It's done. It opens up their life again.
I personally feel that the difference that we're making is huge.
Volunteering in itself is actually good for your health. It's good for your mental and physical well-being. And so it's fabulous to see so many people stepping forward to say, I want to help. And so we're able to support them on that journey, and that's benefiting them now, but also we hope for the future. And they're playing a huge part in helping their communities.
And I'm very proud that very recently we've hit the 1 million mark. We're well on track for 2 million now. And as we go into this winter, not only will we continue with the vaccine programme, not only will we continue with providing volunteers in hospitals and support, we have to get back to the business as usual. The day job, the day-to-day operations are now coming back. So now more than ever, volunteers are needed. And what's next for us? So clearly we have to make sure that we can cope with all of this. We've got to expand our capacity. St John Ambulance is now probably double in size because of all of these brand new volunteers that we're bringing in to the organisation. So we've got to learn how we manage and cope with that. The type of volunteer that we have are very professional volunteers. We have to give them uniform. They respond to emergency calls. They have a patient's life in their hands. This is a sort of volunteering that can be life and death volunteering, but there is also something for everybody, whether that's somebody looking after our logistics store, cleaning ambulances, doing administration, updating our website. Everything has a volunteer behind it. There is a place for everybody in St John Ambulance, and we're really proud of what we can do. But we know we cannot do this alone. We have to build partnerships with other organisations. I've probably got an email box full of 50, 60 hospitals all wanting volunteer support because they're already short of staff as they're going into winter, and that's a worrying sign. I'm really worried about this winter, what it's going to be doing on top of potentially a third, fourth wave, as well as a booster programme, maybe the emergence of a flu pandemic as well. So we've got to think about all of these challenges. We've got to work in partnership with other charities. We've got to work in partnership with the National Health Service. And we really want to become statutory the nation's ambulance reserve. The Army have a reserve, the Fire Service has a reserve, but the Health Service doesn't across England. And already when they press their big red button and panic and phone us, of course we will go. But there is no legislation to enforce the fact that we would respond. And we know from this pandemic that a lot of services would not have continued without St John Ambulance. Other organisations, the Red Cross and others, have done an amazing job. But it's really important now that government organisations step up and recognise the power of volunteers and invest in them.
I think this milestone really represents the hard work, dedication and resilience of our volunteers.
It's an amazing achievement and commitment to the community around us.
We've had young people volunteering at vaccination centres, logistics hubs, training courses, fundraising and so much more. It's been incredible.
We've stepped up to support the NHS during its time of need. We are quite literally saving lives and supporting communities.
That's why I'm here, it's the St John family.
1 million lives.
Thank you for listening, and thank you for coming to this presentation.
Adam, thank you for sharing. And I think the essence of what you're doing is essentially reintroducing humanity to humans. Thank you for doing that. I think we need much more of that in the world today. Is there any questions for Adam in the audience? Benoit.
Hello, so this is Benoit from EENA. So you mentioned in your slides that at some point you had to hire 30,000 volunteers, is that correct? Mm-hmm. So that sounds like a lot in a very short time. So how hard was it with like the training of the volunteers and also to recruit them?
It was quite easy, actually. We had about 90,000 people express an interest in becoming volunteers. But we had to be very selective. The type of person that you recruit for this sort of role, you have to be quite particular. They've got to have the right skills, they've got to have good communication skills, they've got to have the time. So for our vaccinators, they have to give a minimum of 2 shifts a month. And we invest a lot of training in them. Thankfully, there were a lot of empty spaces. There were lots of empty schools, and businesses gave us their venues for free, which was great. The hardest part was the recruitment bit, making sure that we could do criminal record checks. We did references. We did interviews. The difference between recruiting an employee and a volunteer is nothing. It's exactly the same process. And if I was a patient or one of these volunteers were looking after my family, I would want them to go through exactly the same recruitment process, exactly the same training. So we have professional volunteers. That's the sort of volunteers that we are. So attracting volunteers was very, very easy. It's taken us it took us about 4 months to recruit those volunteers, and we outsourced some of that service to private organisations to help recruiting. We outsourced a call centre just to phone people to check references for people. But what this has now done is built a generation of volunteering for the future. So many of our vaccine volunteers now want to become event first aiders or ambulance crew or help with teaching and all sorts of different things, which is great. And some of these volunteers come from very professional backgrounds. So their day job might be a bank manager and they volunteer as a vaccinator. Well, we can use their financial skills to help the charity now. So we are thinking big picture about how we could use them. So there was no shortage of people wanting to step forward. The challenge is making sure we could process them really quickly and making sure that we pick the right person.
Thank you very much, Adam. Are there any more questions? There's an overload of good news in this room. I guess that's difficult to disrupt. Thank you very much. Oh, was there one more?
Yeah,
sorry please go ahead.
Hi, this is Laura from Unblur. I'm wondering, because you mentioned about going through traumatic experiences and that they left some scars, what are your resources to take care of the mental health of the volunteers?
Yeah, that's a really good question. So we had what we thought was a good well-being support network before COVID, but we realised very quickly that wasn't enough. We were exposing volunteers to traumatic incidents that they'd never seen before. And I kind of hinted to the story. I spoke to one of our volunteers who 2 weeks ago was at the side of a football match doing nothing for 6 hours, and now they're holding the hand of a patient who passed away and their family couldn't see them, and they were really upset by that. We've had to recruit full-time staff to focus on trauma support and well-being. We outsource counselling services and trauma incident TRIM practitioners, trauma incident management practitioners, to provide one-to-one support to our volunteers. We've really had to invest a lot of money and time, and that's the right thing to do. We have a relentless determination to look after our people. Without our volunteers, we don't have an organisation. So we've had to step that up quite considerably. It's cost us a lot of money, and I think that's the right thing to do.
Thank you for these important key messages. And if we can now, we will move on to the last presentation of this session. Stephen will talk to us about retaining volunteers in emergency response, which is also one of the key challenges that need to be tackled when creating opportunities for people to involve with their communities. As you can tell, the pandemic provides us plenty of opportunities for new skills, including mask management.
Well, hello everyone. I'm Steven Vercammen. Besides emergency position, I'm also managing director of EVapp, Belgian Volunteer Society, who works as an NGO in Belgium to assist people who are suffering from cardiac arrest. This is how it looks like now. How it looks like is for today not that important. What are we doing? We are an extra emergency service, so I think everyone knows the regular type of how emergency services work. Something happens, we call a dispatch center, and they send professional emergency services. In some countries it's a bit different. There are different type of services that are being sent. In Belgium it's an ambulance and it's a pre-hospital doctor that are being sent. But we are also quite lucky, especially in the north of Belgium. We are quite populated and we managed to get an ambulance or a first resource on the spot within 8 to 10 minutes, which means that our window to assist and actually matter for people is quite limited. Now, for some diseases, that's not that important. If you've got your hip broken or something like that, okay, it's painful for those 2 extra minutes, but it's in medical terms not that important. Now, there are a couple of diseases that those 2 minutes will matter, especially in case of cardiac arrest, and that's where we focused on when we started the project in 2017. Cardiac arrest and later drownings and electrocution were added to the emergency response as well. And that means that since 2017, the Emergency Service Center will not only activate the application EVapp, or not only activate the ambulance, they will do both to offer faster assistance. We started in Hoogstraten, and I'm quite aware that most of the people here don't know where it's located, but it's really close to the Dutch border. It's considered a black hole. For some countries like Sweden, it's maybe even quick, but for Belgium, it's actually a part where regular emergency services take a long time to go to. The average there is around 15 minutes, and if the first ambulance is already allocated to another patient, for example, it can take up to 20 to 30 minutes before we get adequate help there. That's the reason that we started it in EVapp. I won't go into much details, but we're also looking to expand the project further throughout Belgium now. We do that with a couple of universities, large organizations as well, to get this into legislation as well. The topic that I want to address today are a couple of topics that weren't addressed yet. Topics like insurance, how do we attract volunteers, how do we act with people that went to critical patients that are not used to it, because like for example for St. John's Ambulance, they also have a recruiting program. Same thing for us. We ask people to sign in quite easily, so we ask them for address, general information about their training. The training level is quite limited because we want to reach a large part of people that can offer first aid. But we see in general that if we start in a new region, about 50% of the people that are the first adapters, let's call it like that in technology perspective, are people that are already working in a professional capacity as well with critical ill patients. Doctors, firefighters are an important group of people that sign in as first adapters. And later we see that if it gets through the community, that also other people will start to follow trainings, and that those people will get into the program as well, especially after when it's hit the media, for example, or that certain situations have come to light. We see every time a boost in the number of volunteers. What we do afterwards is we check eligibility and validate the volunteers. Are they still sufficiently trained? We offer training to our volunteers on a continuous basis as well. And we do that through an online system, and it's John Doe for today, but we follow people. In this case, it's, for example, a doctor who lives in a certain place. People can also add their work address and other addresses where they are quite often, and the documents are those of the proof of training in the past. Why do we ask for different addresses? It's not to be in violation with the GDPR legislation, but it's because we've got a combination of both an application and an SMS service. All of our volunteers will have the first system, the application, based on their telephone number. But we see from time to time that people switch off their 4G network, that they switch off their location, which makes it hard for us to use those volunteers. So our system is based on the fact that we will always select people that have their full location and 4G settings on, so that we can activate them more efficiently, that we can send them to a volunteer that we know, okay, you're there for the moment, that we can transmit it to the 112 dispatch centers, the PSAPs, so that they are aware what's going on. But in case it fails, and especially in a rural area, it's quite important that we make use of the other volunteers as well. The patient won't matter that a patient or that a volunteer doesn't have his 4G on. He just wants to be helped. And that's the reason that we started soon after the introduction of the program also with a backup system of SMS services. where if we see that 3 people are not responding to a call, we will send an SMS service to people that live or work or have an address close to the emergency as well. We made a roadmap for cities, municipalities that want to step into the program as well. And 2 other topics I want to address later on are insurance and aftercare. The roadmap, why is that important? Because we've learned through experience what it takes to get the community involved, what it takes to recruit local volunteers, because we are based in one city, we want to do something in another city that's 100 kilometers away from it. It's quite hard. I don't know the people in that fire department, so we need the people that can help us become local first adapters, and those people will start to form a local network as well. But it's not always the volunteers that are the issue. Sometimes we see that it's also important to make an inventory of the defibrillators that are being present in the community. And we've learned, yes, there are official lists of the defibrillators in the community, but that by investing in it, that we see that we can find a lot more defibrillators that are for the moment hidden for the public eye, and get them into the system as well, which helps all of us. We try to support with local aftercare. It's not beneficial that I get you aftercare or training in a city 50 or 100 kilometers away from you. That won't help. People won't take the trip towards the next city or things like that. And 2 topics that I find really important to address today. First topic is the insurance. Also a topic that's a bit different from country to country. But in most countries, there is some kind of legislation that says that volunteers that are trying to help somebody are not liable for criminal liability. They don't get sued by other organizations, or the court will not accept those liability as well. In Belgium, same thing. You're not civilly liable for damages caused during your intervention when you try to help somebody. Nevertheless, we've insured all of our volunteers. 2 things. We actively send volunteers somewhere, and even with the best volunteers we've got, people are stressed. People will try to help. They run a red light. They will do things that are not allowed within the law to assist other people. And for that reason, we've taken an insurance for all of our volunteers to make sure that in case they get those kind of problems afterwards, that they are covered for it, that they cannot be sentenced for something that they tried in the interest of a patient. And on top of that, even though we know that there is a law, we took a civil liability for any physical and material damage that a volunteer might cause. And that means also opening a door when it's not allowed, breaking a door when it's not allowed. Next topic that I want to address, and probably the most important topic for me, is the aftercare of volunteers. We are dealing with patients who have cardiac arrest, patients that are in practice really dead for that time being. Most people have never seen it, or have seen it once or twice in their life. They're not used to deal with it. And okay, for regular cardiac arrests and regular deaths, but in the past we've come to pediatric cardiac arrest, for example. We've sent people to suicides, for example, because it was not clear to the PSAP center, for example, that it was a suicide attempt. And those are things that people have to deal with it as well. And we see that, yeah, okay, how do you deal with it to resuscitate somebody if you know that in fact he wanted to die? How do you deal with it if you have to resuscitate a baby, if you know that there are 10 mothers around there that are crying all the time? Quite of a difficult situation, and that's the reason why we've made a 4-step care program where we try to involve everybody. First step is the hot and cold debriefing, and it's something that we've asked to all of the local ambulances and emergency doctor services that are operating, is a hot debriefing on scene. That means I'm arriving as an emergency physician on the spot. I see that there are 3 volunteers on the spot who have provided first aid, who provided CPR on the spot. What we ask from those doctors is that they take 1 or 2 minutes to just tell our volunteers, well, you've done a great job today. Whether or not it was successful, it doesn't matter. They've tried their best, and it's important because we know that in most of these cases, even with first aid on scene, that most people will die after cardiac arrest. So that's an important one. And that it's not the doctor, oh, well, you've did that and you should have done that. No, it's not the time, it's not the place to do that. So we try to do this backup system if it doesn't work on the scene because the patient is too unstable or whatever, is that we provide a cold debriefing afterwards in the hospital or in the station where the ambulance is stationed, so that people can go there and that they can do a joint debriefing with everybody together. What happened? What did you see before the ambulance arrived? What did the ambulance notice when they arrived? And it's also in the professional world an important step to get most people over their traumatic event. Next thing that we do as an organization in person then is that we will send a feedback form to all of our volunteers. It's going over a lot of things. It's from technical performance. Well, was the navigation in your system correct? Was the location correct? And we get feedback from that to improve the technical performance of our application. But it also goes over other topics, like you've got medical questions, like did I did the right thing, for example, should I have done this or that? And we also always ask for, do you need psychological assistance as well, because it's an important thing to take into account. If people say, yes, well, it was difficult, we can go to the next step. And for that, we've got the cooperations. It's also a translation to English, but we work together with a couple of general welfare centers. Those are people that are trained professionally to assist people in critical situations, to help them. We've got a cooperation with the Red Cross, for example, but also, for example, in Belgium, the fire department has a system where they provide assistance to the firemen as well, and they agreed to assist our volunteers as well. And in a couple of cases that was needed as well, especially after pediatric resuscitations. Last step is that we transfer them to the aftercare. If we see that 1 or 2 sessions are not sufficient, we often think that there are more things to the story than just the traumatic event, and that the long-term assistance is needed. And for that, we've got agreements with professional healthcare services so that they can get a long-term follow-up as well. One slide to summarize it all. Always important to help volunteers for their help. Give attention to the volunteer, what they've done, how hectical, how critical a situation might be as well. It will help them to keep them involved in the cause of your project. So that's my last slide. I'm not sure that there are any questions for today.
Thank you very much, Steven, not just for comprehensively mapping out the institutional challenges, but also for sharing an important spotlight on the fact that volunteers need to recover, to recommit, which is a very important message. I've learned in my personal life that you can only give of what you got. And as we all care about them coming back, your messages I find are very key to address this. Now, this is your time to ask questions to Stephen and in fact to all panelists, because we've got the last 5 minutes to talk about volunteering together. So are there any questions in the audience? Yes, please. The mic is coming.
Hello, I'm Jos from Holland. First, my compliments on your presentation, Stephen. You mentioned the example of Hoogstraten. Do you have any experience with cross-border alarms?
Yeah, and it's quite... I hear that you're from the Netherlands. I work both in the Netherlands and Belgium, and there are two examples. I think the Netherlands is one of the most innovative countries in regards to first aid volunteer networks. We are trying together with the Netherlands as well to get a system to share that kind of information as well. Problem with that, if you look at the map of Hoogstraten, for example, you see that there are some islands within the Netherlands that are part of the Belgian territory and the other way around. And in those parts, we see that there is already cross training and cross assistance between emergency services, and it's going a long way, because if I'm going with a Belgian cell phone just across the Dutch border, I might be connected to the Belgian emergency dispatch center, the Belgian PSAP, while somebody from the Netherlands that's reporting the same emergency will report it to the Netherlands. So we know, in fact, that there is already cross-border cooperation. But there's a long way to go between all of the countries, and I think the European network that's being established is an important initiative in that, so that I can help in the Netherlands as well on the Dutch network, for example, which is for the moment not possible because I've got a Belgian telephone number, and on the other way around, there are some difficulties as well. So there is still a long way to go, but I think it's the future.
Thank you for raising the cross-border challenges. We have a similar experience in Central and Eastern Europe, where we do need to come to each other's aid in larger disasters because of limited capacities and capabilities in individual member states who are neighbors. And what has proven to be crucial is prepare for that ahead, because we have teams which exercise and interact together periodically to maintain that ability to respond together, and they perform fantastically when major events like huge floods and other disasters that challenge national capacities and require volunteers from other countries to come to their aid. So it's a very important challenge that we can only address together again. Thank you very much. Are there any other questions in the audience? I warn you, if you don't ask, I'll ask. I see no hands raised, so could those of you who have a volunteering experience raise your hand so that we know? Wow, so this was a peer-to-peer session. It was lovely to have you guys. Thank you very much for coming, for sharing the inspiration with our colleagues presenting, and I look forward to meeting you again. Have a great day.